So far, we've had examples of conditions and kinds of conditions that the herbs might be useful for, but that is based more fundamentally on what are the actions of the different herbs. We can consider these from the chemical actions of the individual constituents, or we can look at them from the effect on the body of constituents of herbs and what effects we might want from a blend of herbs so they act to affect the overall condition of the person who needs them. So, this is where we get to the nuts and bolts of how the herbs work in order to have a blended effect. So, we're teasing out the herbal actions, which we then blend the actions together for particular conditions. So, it's the nuts and bolts of herbal medicine as used by medical herbalists. The kinds of actions are described in the next 3 slides. And the first action we'll describe is a carminative action. And a carminative action is a soothing effect, often an antispasmodic effect on the digestive tract. We can also consider a trophorestorative aspect of the herbal constituents, and that would be to nourish and restore the basic function. For instance, the mucous membrane is a defensive barrier which stops invasive bacteria or viruses entering our internal systems. And if that mucous membrane isn't nourished well, and if it has become weakened through a weakened immune system, we want a restorative action of the herbs on the mucous membrane. So trophorestorative is a building up and a nourishing effect on whatever particular tissue you might be interested in affecting. An alterative action is what medical herbalists would traditionally call a cleansing effect. And the cleansing effect, it's often described as a blood cleanser. And in order to have a blood cleansing effect, you want to promote elimination from the body. The alteratives can act on the bowel, the bile, the skin by promoting clearing through the skin, often through sweating. But there are also waxy glands in the skin, which may also be influenced. The other main eliminatory function is through the kidneys. The herbs may have a diuretic effect, which is increasing urine secretion via the kidneys. The liver and bile would be crucial to this for many modern congestive conditions, and this is a feature of many of the blends, is to have an alterative action on the bile in particular. Nutritive effect is pretty much straightforward as described. Many of the herbs are green foliage, so they will have chlorophyll and many of the vitamins and minerals common to all green leafy vegetables. The roots are again very rich in minerals, particularly roots like dandelion roots and nettle roots. Siberian ginseng would also be a good example. Anxiolytic herbs are again pretty much as described. They have a relaxing effect on the brain chemicals in particular, but many of these brain chemicals are also expressed in the body tissues. There isn't a dividing line between the body and the tissues. A good example of that would be serotonin, which is acted upon by antidepressant drugs. But there are also different kinds of serotonin which are very active in the gut. In fact, over 90% of all the serotonin in the body is actually a feature of the digestive lining. So, nervines for nerve tissue in the brain and also neurotransmitters in other tissues would be, again, a very common feature of many of the blends used, because so many of my patients and people in general are suffering from ongoing stress. Diaphoretic effect is an effect of promoting sweating. And this can be a very useful effect short term for managing fevers, but also would be part of the alterative effect in blood cleansing. Antimicrobials, this can cover fungi, viruses. We've already described the elderflower as having an antiviral effect. Marigold would have an antifungal effect. And there are various other examples. So it's a direct effect on helping the body to fight off invasive agents. Adaptogens help the body cope with chronic stress. And what we find these days is that many people, instead of occasionally having an emergency reaction, the same as the fight or flight reaction, if you were to be chased by a bull or a tiger in a field, you would discover hidden resources to help you run faster than you ever did before and jump fences that you would never previously have even considered. But many people these days, they're not just being chased occasionally by a bull, they're actually living in a field with a bull, and they're constantly on alert for dangers. They're constantly looking over their shoulder to see where the bull is, whether they're coming toward them, whether they're running away from them, and constantly having to adjust their position and live in a mode of being alert constantly. This can be a feature of too little sleep, too little exercise, too many hours at work, functioning on too many different levels. The end result is the adrenal glands, which are the master switch for our fight or flight reaction, actually are using these reactions on a day-to-day basis, and the body no longer has a background resource because of this constant alert mechanism. So adaptogens are performance herbs which specifically help address depleted adrenal function. A good example of this would be Siberian ginseng, which is used as a performance enhancing herb, particularly in the context of an exhausted adrenal system. Nervines have a particularly important place in modern herbal medicine. I talked a little about the importance of stimulating the bile and ensuring support for liver function. And in combination with that, we are looking for nervines to have an effect on different aspects of body chemistry. And in choosing between all the different nervines, for the blends, we're looking for the strengths of that nervine in conjunction with the other herbs of the blends for addressing that particular problem. For example, for chronic anxiety, where people are exhausted from dealing with stresses over a long period of time, we're looking for stamina support for the nervous system. And this would be choosing a nervine like wild oats. If a person has chronic digestive problems, such as irritable bowel, in conjunction with stress or anxiety, we might be looking for a bitter herb because we want an additional effect on the bile and the liver. And we also want, in general, a cooling effect on the body that we would get through bitter actions. And these would be particularly important at the menopause. So then we might choose herbs like hops or verbena. If we're looking for a calming effect on an overstimulated gut-brain balance, then an ideal herb would be chamomile, which has a particular effect on the digestive tract. It also has a small bitter effect. So these aren't pure effects, they're kind of particular strengths rather than dividing them up into strict categories. If we're looking for a sedating effect, for example, somebody with migraine might have a chronically overstimulated central nervous effect, which is influencing the circulatory system. Then we might look at a herb such as passiflora or pulsatilla, and again, hops. And for women with migraine, the hops may be particularly useful because they also have a hormone balancing effect, which can be beneficial. If we're looking for somebody whose main complaint is anxiety, then the direct anti-anxiety herbs would be used. One of the very gentle ones, despite its rather alarming name, it has a very gentle, ongoing supportive effect, would be Skullcap. Again, the chamomile would be very useful because very few people with chronic anxiety won't benefit from a calming antispasmodic effect on the gut. And valerian, which is probably the most well-studied and one of the herbs with most effectiveness shown for its anti-anxiety effect. It's important that valerian would be used on an ongoing basis, and in general that most of the nervines would be used on an ongoing basis, particularly for chronic stress. They can be used short-term for short-term stress, for example, doing exams or doing a presentation at work or getting through a family event, which might be difficult. But for chronic ongoing stress, herbs should be used for a minimum of 3 to 6 weeks to have a sustained effect, and to convince the body that it no longer needs to be alarmed and that it can settle into a more comfortable state of self-regulation. Demulcent or mucilaginous herb effect is one of cooling, slippery, slimy, can be nutritive, and when you swallow it internally, you cool and soothe the stomach. You help an inadequate mucous membrane lining of the stomach due to too much acid or too little acid. As it goes down through the digestive tract, it has a cooling and soothing and protective effect. Because it cools down the core of the digestive tract, it also has a reflex cooling and soothing effect on other organs and systems supplied by the reflexes from the spinal cord that are shared with the digestive tract. And these would include the organs of the pelvis and also the lungs. And it would also have a reflex effect on all areas of the mucous membrane linings, including the vagina. So these herbs can be very effective for chronic vaginal conditions. So a cooling, nourishing, soothing, and protective effect makes the demulcent and mucilaginous herbs very helpful for very many conditions, including allergies and lung conditions, hay fever, irritable bowel, irritable bladder. They would be good examples. So moving on to wound healing, or what we would call a vulnerary effect. Obviously, if we ingest them through the digestive tract, this would have an effect of healing any irritated or inflammatory conditions of the bowel. So gastritis, stomach ulcers, diverticulitis, including immune conditions like ulcerative colitis. And these would have a very safe effect. Herbs like marigold, for instance, would have wound healing and antimicrobial and antifungal effects and be a very gentle herb. So that would be a good example. Styptics are blood stopping, so they stop bleeding. A good example topically would be yarrow, which is called carpenter's herb in France, and nosebleed in the English language. And the idea would be that you would pick a yarrow leaf and roll it up into a little ball and put it up a bleeding nostril and then squeeze to put pressure. Or you would wrap a cut from a carpenter's tools. You would wrap any cut in yarrow leaves, and that would help stop the bleeding. Internally, they are used to help with irregular menstrual bleeding and any internal gastritis or anything that would be debilitating from that point of view. If somebody has any kind of bleeding from the gut, it goes without saying that they should be under medical supervision. But if it's an ongoing problem that has been dealt with medically, these would be safe herbs to use in that context. A tonic herb, it sounds like a very old-fashioned word, but in fact what it means is to build up a depleted constitution. And you can do this by lots of different ways, by nourishing, by stimulating the digestion so that the assimilation is more effective. You can do it by energizing herbs such as the ginsengs. So there's lots of different ways that you can have a tonic stimulating effect. Coffee and tea would be a tonic, but used too much or without balancing it with other tonic effects, you can get into difficulties. So tonics should always be matched with the amount of energy that somebody has in order to be stimulated. Stomachaches are herbs that ease stomach conditions. A good example would be a herb like meadowsweet, which will gently stimulate stomach acid. But if somebody is suffering from too much stomach acid, it won't actually increase an excessive stomach acid. But if somebody has low stomach acid, the filipendula will have a gentle stimulating effect. And this is one of the characteristics of herbs that I really like, which is that the body chooses what it needs under its own individual circumstances. So if somebody has high blood pressure, in most instances, if you use herbs for high blood pressure, like rosemary, if somebody's blood pressure then dips, which it can do in the elderly, the rosemary won't add to that dip. In fact, it tends to normalize the blood pressure. So it will reduce a high blood pressure, but minimize the effect of low blood pressure. So it has a stabilizing effect on the blood pressure. Sedative herbs As a medical herbalist, I don't often use herbs which have a very sedative action. A good example would be hops, which is commonly used in over the counter remedies for sleeping. But if somebody has a sleeping problem and they're actually insomniac, I don't find that the sedative herbs are enough in themselves to overcome a chronic condition. So I would always use sedatives along with anxiolytics, and I would tend to use anxiolytics and antispasmodics during the day so that a person doesn't get quite as uptight and resistant to sleep by the time they go to bed. And then I might add in sedative herbs such as hops or wild lettuce or Eschscholzia california, the Californian poppy. But I would very rarely use them in isolation from herbs to relax and restore the nervous system throughout the day over a period of time. Hops can also have a very heavy sedative effect. So, in somebody who has very low spirits, traditionally medical herbalists wouldn't use hops because it's just a little bit too heavy. Anti-allergy effect is pretty much as described. You can have an anti-allergy effect by strengthening the mucous membranes or by dampening down the allergic responses on a cell level. A good example of that would be using nettles for allergies. This is the last slide that describes the actions of herbs. And you then think like a herbalist when you are going to use a herb or recommend a herb or blend a herb with other herbal actions. You're looking at choosing another herb which has an action which complements the one that you're thinking of using. So, a diuretic herb is one that promotes the loss of fluid through the kidneys. This is not at the expense of electrolytes. Either the herb has electrolytes such as potassium, I'm thinking of dandelion leaf, but the herbs can't overpower the body's ability to normalize itself. So it's not going to lose electrolytes due to the action of the diuretics in general. So they would clean the blood, they would support poor liver function, because if you have poor liver function, you want to improve the excretion abilities, maximize and optimize the excretion abilities of the kidneys in order to reduce the pressure on elimination through the liver, because they have some overlap of function. A diuretic is also helpful with things like premenstrual syndrome, where there is a bloating and a retention of fluid in response to poor function in the relative amounts of hormones which are changing at different stages of the menstrual cycle. So, a diuretic can be a very useful action, also useful for regulating blood pressure. And this is a way of reducing the force against which the heart has to pump the blood. If the extracellular fluid is sluggish and poorly balanced, then a diuretic effect helps reduce the pressure in the extracellular fluid. And it's one of the ways in which, by very gentle effect, the herbs can help with high blood pressure. A laxative effect probably needs very little introduction, but in herbal terms, there are laxatives which help because they moisten the stool, such as a demulcent action for a dry stool. It's like coating it with mucus so that it's easier to pass. The most helpful action is stimulating the bile. Bile is the body's natural laxative, and all of the bitter herbs will stimulate the bile, and the bile salts will help with the natural stimulatory laxative effect. And that's the ideal action for people who have, especially with a chronic constipation, because it's a normalizing action. You can then go on to stimulatory action of laxatives. A gentle laxative stimulating effect would be a herb like dockroot. And this is usually what herbalists use for a laxative effect. As a herbalist, I would very, very rarely use senna leaves. These have a very powerful stimulatory effect. It's stronger than the body's normalizing influences. So if the body gets used to relying on external stimulatory effects of herbs as powerful as senna leaf,
then the body's own urges and own stimulatory mechanisms get lazy and they accommodate by not being used. And therefore, you have to relearn how to have your own stimulatory effect if you use senna long term. So, from a herbal point of view, it's a herbal action, but it's not a normalizing action, which is what the most ideal herbs would be trying to achieve. The next action is astringency, and astringency is a drying and toning by not. If you think in terms of congestion and encumbrance, which we will go on to, astringency helps squeeze. I always imagine a flannel which is soaked with water, and an astringency effect will be to wring that flannel so that you squeeze the excess water out of it. The other way of understanding astringency is to drink some black tea and swill it around your mouth, and you will feel a puckering, a dry puckering, and that's an astringent effect. It's a squeezing effect and a drying effect. For many people who are bloated and sluggish, this is a very useful effect. I use it for people who have hormone imbalances and that bloating that comes from hormone imbalances. A lot of pelvic conditions, such as endometriosis and even polycystic ovarian syndrome. When else would I use an astringent action? Allergies. Oh, most importantly, would be leaky gut, because in leaky gut, you've got that poor tone in the mucous membrane lining, and you have reduced efficiency of the sticky pads between the cells lining the mucous membrane. So an astringent action would help improve the tone in the wall of the gut, which is very important for not absorbing the larger molecules that we're not designed to absorb. So that would be an example of astringency. Black tea is an astringent. Agrimony is an astringent. All of the geranium family, which include the wild herb Robert and Geranium robertum. Now, bitter herb actions are wonderful. I can think of very few people that don't require bitters if they have any health problems. The reason for that is they stimulate bile, and bile improves hormone function. It also has a laxative effect, as I said. It also, combined with fibre, helps excrete cholesterol. So these are all very helpful actions. But probably the most helpful action is that it has an effect on the vagus nerve. And the vagus nerve is from the upper digestive tract, and it wanders. That's why it's called the vagus nerve. It has this long meandering track all the way up to the brain. And the overall effect on the brain is to change the balance of the parasympathetic to sympathetic tone. The parasympathetic tone is our calm and relaxed metabolism, whereas the sympathetic tone is our fight or flight reaction when we realize there's a bull in the field with us. It's also the reaction that's stimulated continuously if we live with chronic stress. This is the reason why so many people benefit from the bitter actions. This is a reason why I don't make any apology for the bitter tastes of blends of herbs that I use, because it has an immediate action via the vagus nerve, and then when you swallow it, it has a further action. The action in the mouth is through the bitter receptors, and they have a direct effect on the brain. So, very important herb action. The native herb in Ireland would be bogbean. We have a small amount of gentian, which is very precious. It's a feature of the Burren, which is a habitat in County Clare, which is limestone, and it happens to have gentian growing. It's not to be collected or used medicinally because it's such a protected flower species, which is absolutely beautiful. But we do use gentian lutea, which is a yellow flower. But our native herb would be bogbean, Menanthes trifoliata. Don't worry about the Latin. I just like the sound of it. So the bogbean is also anti-rheumatic and antispasmodic, and it has a bitter action. Many other herbs have a much milder bitter action, which we would include as herbalists as a general background toning effect for the digestive tract. And herbs like that would include chamomile, that bitter taste with the chamomile. And that's one of the beneficial actions of it. Yarrow would be another herb that would have a bitter action. So bitters are wonderful herbal action for most people who suffer from nervous anxiety and also sluggish digestion and general foggy brain, poor memory, all of those features of leaky gut and candidiasis. The bitters are also very good for the bowel flora, the microflora in the bowel. So, fabulous thumbs up for the bitter action of herbs. Detoxification. This is a very misunderstood term. The action that you're looking for with detoxification is that we produce toxins as a normal part of our cell metabolism on a 24-hour basis, minute by minute, because toxins are created as we metabolize normal chemicals in our body, our own normal chemicals. And they go through stages where sometimes they are made more dangerous, more toxic, before they are rendered into a condition where they can be excreted, usually by the liver or the kidneys. So there's interim toxins, which are part of making some chemicals available in a form in which they can be excreted. More and more we are being exposed to toxins in our food through herbicides and pesticides. And the problem with those is that there are safe levels for each herbicide, each pesticide, but there aren't safe levels, and indeed there isn't a lot known about the combined action of one herbicide, one pesticide with air pollutants and over the length of time, over a lifetime. For instance, children that are eating processed foods now are being exposed to these foods over their lifetime from the time that they are babies. And there is no cumulative toxic safe levels. And the other large source of toxins is fungal mold, which in Ireland, because we have such a damp climate, can be quite significant. Plastics, including the plastics in cars, on dashboards, from those hard plastics, but also the plastic that we wrap our food in. And I'm not saying all of this to be pessimistic. There's a certain amount that we can do to minimize all of these and look after ourselves in what can be a very toxic environment. So what we want to do with detoxification is specifically help the body to neutralize these, make the metabolic pathways more efficient so that these interim middling molecules in this process aren't hanging around long enough to do any harm. And we can promote all of the excretory processes. So in a way, detoxification is a modern word for an alterative action. They're not exactly the same, but there's a good correlation between the two. If you want the one detoxification herb that wins hands down, it's dandelion root and leaf together, primarily the root. It promotes liver action, which is liver enzyme function, which is where a lot of these metabolic processes are centered. It increases the bile, so you have a laxative effect. It increases the flow of bile and the production of bile. So that is probably the detoxification plant of excellence. Many people are familiar with the milk thistle. It seems to have a much better press and presence in people's minds when they think of herbal medicine. And it is a wonderful herb. It's not nearly as available to people because you have to go and buy it in the shop, but it also has an effect almost purely on the detoxification process in the liver without having this wider effect on bile and blood cleansing. So I rarely, or I would say virtually never, use milk thistle without using dandelion. I have enormous respect for the dandelion. And that nicely leads us on to the effect of hepatics. And for a purely hepatic action, I would quote the milk thistle as described. I would say that the dandelion root in particular also has an hepatic effect, and they would be the main herbs that we would be considering. A choleretic, it promotes bile flow, and the one that might come to mind would be the dandelion root, as I said, but also a herb like artichoke, and that would be one of the main actions, and that's one of the reasons why it's helpful for cholesterol, would be what it's most commonly known for.